Let's talk about some of the different pain relief options that you're going to have when you're in the hospital. First, we are going to talk about the least invasive and then we'll go into the most invasive. I want to explain how we use these different tools in practice. Nitrous oxide is a gas that is breathed in. And because the gas is breathed in, that means it's also going to be breathed out. And by that, I mean it's going to quickly move through the mom's body. So when mom breathes in nitrous oxide, it's the same nitrous oxide you would get if you go to the dentist. However, it is mixed with half and half oxygen and nitrous oxide. So you get less of a dose when you're in labor and delivery than you're at the dentist. It is a self-controlled medication. So when mom holds the mask to her face, she's able to breathe in the nitrous oxide and get the relief. When she removes the mask from her face and takes a couple of deep breaths, the effects of the nitrous oxide should quickly wear off. No one except the mom should be using the mask. No one should hold the mask to her face. We can't tie it to her face because the fact that she has to hold the mask to her face is its own self-limiting safety mechanism. If she gets too tired or if the medication is too strong and she gets a little woozy, she'll drop her hand, take a couple of breaths, and come back to us. So that's a reason that it's indicated for only mom to be the one to use the mask. Nitrous oxide works great to help relieve anxiety and stress. So if mom is in that fear, tension, pain cycle and she's really stuck on fear, sometimes nitrous oxide could be all she needs to just relax a little bit more, take a few deep breaths, and feel more in control of what's happening. Nitrous doesn't impact pain directly the way opiates and epidurals will. However, nitrous oxide can potentially lessen some of the pain she feels. It'll give her a feeling of giddiness or excitement, which can help her manage the contractions, especially as she gets further into active labor and transition. Another great time to use nitrous oxide is if a mom wants to get an epidural and is terrified of getting it. She can actually use nitrous oxide while waiting for the epidural, and while it's being placed, she can be using the nitrous oxide to help keep her calm. Having nitrous oxide doesn't mean that she can't get an epidural. It does, however, limit her if she wants to get into the tub, and that's because I don't want my mom to accidentally pass out and then drown. If mom's using nitrous oxide, you're going to have to ask what the hospital's policies are as far as her moving around, staying monitored, etc. If we're giving her any sort of intervention, including pain medication, that is still considered a medical intervention. So if we are choosing to have pain medication, we just want to make sure she uses the brain acronym and goes through the benefits, risks, alternatives, what her intuition says, and what if she would do nothing, so that each decision can be one that she has made empowered and of her own right. Next is IV opiates. The opiate that we most often use in labor and delivery is going to cause mom to feel a little drunk, a little high. A lot of moms say that it'll take the edge off of the pain. However, most moms are going to say that it doesn't do much for pain. It just made them really, really sleepy. So if mom chooses to use IV pain medication, just make sure that she knows that yes, it's going to help with the pain, but the signals that IV pain medication blocks are not the same signals that are going to be sent when the uterus contracts. Because when the uterus contracts, it's going to decrease the oxygen flow to that tissue, which is going to elicit that pain response. And it's going to tell the body something's wrong. Opiates are going to stop the signal at the brain. When you have contractions, the amount of pain is going to adjust from high to low. If you imagine that you just had surgery and take pain medicine, and if you're lying down, you might be totally out of pain. But if you start moving, there's going to be breakthrough pain. The same thing happens when you have opioid pain. Pain can still break through, especially at the peak of the contraction. So it's just something that mom would want to be made aware of before she's in the hospital and in labor to make that decision. Then there's epidural anesthesia. Epidurals were invented in times of war. We could amputate soldiers' legs in the field. It was a field medicine technique without having to sedate them and still provided extended pain relief. Epidurals numb you from wherever they're placed down. They do have a lot of risk factors. However, one of them is that epidurals cause relaxation in the part of the body they're impacting. So if it's at the spinal cord, at the sacral level or the thoracic level, then it's going to numb the feeling, the sensation, and your ability to move everything below that point. So if we have an epidural right at that lower lumbar spine, which is usually where we place them, then she's not going to be able to feel or move her legs, depending on how strong the medication is and where exactly it gets placed. So when moms have an epidural, she's not going to be able to feel that contraction pain because we're stopping the signal at the point of the spinal cord. So we're not allowing those pain signals to even travel up the spinal cord. What that is going to mean, though, is that the vessels in her lower extremities, so her legs, her feet, her ankles, those blood vessels are going to relax. And when they relax, they're more likely to pool blood. So she's more likely to get a little swollen in her legs, her ankles, her feet. That can also be attributed to the continuous fluids that we give mom when she's got an epidural. If she's got an epidural, she is going to need to be on continuous fetal monitoring and in the bed. You can't be getting up and walking around when you have an epidural. But that doesn't mean you cannot move. There are still ways that we can move you around in the bed safely that are going to still facilitate that healthy physiological birth that we're going for. So let's get into epidurals a little more specific.